Hello, everyone. My name is Ilir Lako. I'm here to represent Dignity Health. For those of you who may not be familiar with Dignity Health, we're a healthcare system mostly based on the West Coast. We are comprised of about 60,000 caregivers and staff, providing excellent care to diverse communities in 21 states in the country. And as of beginning of 2019, we are now part of Common Spirit Health with our merger with Catholic Health Initiatives, and that makes us one of the biggest not-for-profit healthcare systems in the country. Today I want to talk a little bit about our digital transformations in healthcare and how Okta plays a role in it. But before we talk about healthcare, I kind of want to take a step back and talk about another traditional industry, so banking. Raise your hand if you've, in the last 10 years, gone to a bank branch to deposit a check, to do some transactions. Yep, fair amount of you. And now raise your hand if any of you had to wait in line for any of those times in the last 10 years. Yep. Now, raise your hand if any of you in the last 3 years haven't set foot in a bank. So as you can see, the banking industry has come a long way and has put the tools there to give us an experience that we can bank at our convenience, we can do things at our convenience without having to interact. And as you saw yesterday from the presentation, like Ally Bank is a bank that doesn't even have any branches. So we think healthcare is very similar and has a long way to go. Now let's think about your experience of going to a doctor's appointment. Well, the first thing you need to do is make an appointment. So usually you make that appointment if you're seeing a doctor, and so it would be a follow-up appointment, or you'd have to call a doctor's office. Usually when you call them, they'll ask you for information about yourself, trying to verify who you are, the reason why you're calling, and then you kind of go back and forth maybe a couple of times with dates and times that work for your schedule, and 10, 15 minutes later maybe, depending on if you're on hold, you have an appointment date. The next thing is you need to get to the office. When you go to the office, if it's your regular doctor, you're probably familiar with the office, you have no problem going there. But if it's a new place, or if it's an office in a large hospital, you have to navigate your way around, and sometimes it takes a little more effort. People get lost. But let's say you successfully navigated that. You get to the doctor's office, and you have to check in at the front desk. They take your information. They probably give you a pad to fill more forms about yourself with information that most of the time you've probably given it to them in the past, and you're wondering, why are you asking me the same questions, which you should already know who I am. You kill some time filling out those forms, and you're waiting in the waiting room. And if it's the end of the day, maybe they're running late, the wait gets longer. But these are all experiences that we are familiar with. And when you compare it to what the banking industry looked like in the past 10 years and how far along they've come, we think that there's a lot of improvement for doing the same in healthcare. So the big question is, how do we provide the tools, and how do we build the products that our patients expect with a standard that they've come to expect from other industries, such as finance, travel. And so we at Dignity Health did a lot of work on trying to map our patient journeys and understand our patients' and consumers' needs. And at Dignity Health, Office of Digital was created, and its main purpose was to create an intensely, positively, and personalized patient experience, a digital experience. And if we walk through these chevrons, think about now the same experience we talked about doing in person, but doing it online. So you can go to our site, browse for the products, browse for the services and the doctors that we offer. And then once you found a doctor that you like, you can search their schedule, and you can schedule an appointment with them online without having to call anyone. And now that you've scheduled that appointment, you have a central place, what we call My Home, where you can go in, view all your appointments, view data about you, view your profile. And after you've seen your doctor, you have your patient portal, where you can go and see your medical records, message your doctor, or see lab results. And then later on, maybe you need a quick interaction with your doctor, but you don't want to go to the office, you do a telehealth visit. So we've taken the same journey that you would have to do in person in every step and converted it into a digital journey. And we thought hard about it, what components we need to put and what building blocks we need to put in place to have that great experience for our users. But we all started somewhere, right? And if you're in healthcare, I'm sure your picture looks very similar. We all had, Dignity Health is a large health system, and then we've grown by acquisitions and mergers. So we had many hospitals that had different EMR systems. And most of you remember when in 2009, the American Recovery and Reinvestment Act required healthcare providers to attest to meaningful use of EMRs in order to maintain same levels of reimbursement for Medicaid and Medicare. And at the same time, they also provided incentives if you attested, or there were penalties if you didn't have all these things in place by 2015. So a lot of healthcare systems put in place their EHRs, and along with that came patient portals, which most of the time were tethered one-to-one with the EHR, and it worked great. People were attesting, but it wasn't the greatest patient experience. In our case, we had multiple patient portals, and some of those were spread geographically because different areas had different systems. Some of them could be in the same region, whether you were in an ambulatory office or whether you were in the hospital. So that created, an experience for our patients where you had multiple logins across the products, and patients had to remember those. And it wasn't a great experience. So the more products we started trying to offer to our patients, it became more obvious that we needed a platform to build on. We needed a modern and secure identity system, which all our products would be built on. So we started this project, and the motto was one person, one login, one password. And the idea is that we would create a single entry point with one password that would allow you to access all our digital products. Another main piece was Dignity Health would own the identity. So we would not rely on any other vendors. We were the keepers of identity for our patients. And we would ensure that Dignity Health would have a consistent brand experience across all our products, regardless of what vendor the product came from or what team built it together. So we set together in this long journey to build the system together, and Okta was part of that process. So we picked Okta as our Dignity Health identity system. And our project went live in April of 2017. And now that identity system powers My Home, which allows people to search and schedule for appointments, view their profile, view their future appointments, provide telehealth visits. Some of the features that you might be aware of and might be using in your solutions with Okta is Universal Directory, obviously, single sign-on into our products, API access management was another piece that we made a big use of. And then we had, on our side, we had both OIDC and SAML integrations, so we kind of had a taste for both flavors. We used custom email templates and custom email domains, and that was one that we actually pushed hard, and we were probably one of the early adopters for it when it first came out. Currently, we support both self-service password resets and temporary passwords via support agents. And we've also made use of the single page or the sign-in page with custom URL domain. So that is all part of having that consistent experience for our users where everything they see is Dignity Health. But that wasn't always the case. So we still have a lot of work to do. The future is that everybody has one login across all products and all our patient portals, all our other products. We're not there yet. We're good ways in our journey, but we're not quite there yet. The next big piece that we're going to do, and we're actually about to go live in a couple of months, is uplifting the identity from our patient portals, which is MyCare. Cerner is our vendor for our EMR and patient portals, and currently those patient portals, the identity lives with Cerner. So we're uplifting that, switching over to our identity platform. And that's been a big undertaking. That it's been a really great experience in collaborating between our teams, the Cerner teams, the Okta team, to come up with a solution that it's not only safe and secure, but also elegant and the least disruptive for our patients, because we have patients who are coming in and just signing up for their accounts. But then we have also a large number of patients who will need to be migrated from the one identity system to the other. And this is kind of like a very high-level diagram of what we do. So we have our identity cloud in Okta. We have our cloud hosted in Azure with all our API services and CMS. And then Cerner on the other side has opened up their APIs for us to collaborate. And the result is a unified experience across My Home and MyCare. We have both versions of web desktop version of the apps and also native mobile apps in both Android and iOS. So when you look at this, some of you might say, I have patient portals, everything works fine. Why am I doing this? Or why should I take this effort and go through these steps? And initially, if you just have a patient portal, it's probably great. But the moment you start offering different products that go across different vendors and you need that unified identity, that's when this solution makes it all come together. So what we've seen is that what we put together, it benefits our patients because now they have a simplified access to digital services. They're better engaged in health and healthcare because their whole experience is easier. They can do everything online. They can book their appointment, they can message their doctor. It makes it easier. They can do it at their convenience. And it's better and it's more personalized. We know more about our patients and we can track their journeys and offer them services that are personalized to them. And from the healthcare systems perspective, we know so much more about our patients now because we can have deeper insights. We can track this whole journey from them coming in our site the first time, create an account, schedule an appointment, and all the way to having the patient portal, interacting with their doctors, having follow-up appointments. And we can better understand our conversion and non-conversion points so we can tailor our products and change them to make improvements there. Another big one for us is reduce support calls. In the past, a lot of times people would call and say, my username and password isn't working. And sometimes they put in the username and password from one portal and they put it in the other. And sometimes people couldn't keep them straight. Or they said, why do I need to create another account? There's a lot of confusion. Like, how many accounts do I need with you guys? And we've all been there. Sometimes you get frustrated and you say, I'm done with this, this is not good. So in reducing support calls, we have higher user satisfaction, and the support calls also come with a financial price to it, so that helps the health system as well. And many of you might look at it and say, is this a journey we want to embark on? We're well in our journey, and we're looking forward to kind of getting further into it and getting in that future state where everything is powered by the same identity system. It hasn't been the easiest journey. I mean, there's a lot of work that went into it, a lot of collaboration between the different teams involved, and a lot of times we've asked the questions that sometimes aren't answered yet, and we've pushed all our partners at times, but it's been a very rewarding experience for us, and the feedback we've got from our patients has been positive. Thank you.
Okay, thanks, Ilir. So, Dignity Health story. Again, this is healthcare in general and industries that are making significant change. And it's more than just about the product, but everything that our customers do internally to fight that battle and make meaningful change. And that's actually one of the reasons Dignity won our Evangelist Award this year at Oktane. So I just wanted to major congratulations to Dignity for that. Okay, so our next speaker, Sascha Kaitos, is head of digital transformation at Hannover Research. And you know, when it comes to companies that have a significant global presence, 38 offices around the world, it's a lot to get them to all be aligned and buy into making change and adopting the solutions that we are trying to make it easier and more secure for their end users. So this is a little bit of the story you're going to hear from Sascha.
Thank you. Yeah, hi, my name is Sascha Kaitos. I'm going to tell you today a little bit about our story when we started with Okta 3 years ago with our idea of building an authentication framework to drive our digital transformation and to make our customer and our employees more successful. But first things first, I want to tell you some facts about Hannover. So we were founded in 1966, and we have approximately 3,300 to 3,500 employees worldwide. So we are operating in a lot of countries, and we have offices in 38 offices all over the globe. So, but for those who don't know what reinsurance is about, that is the insurance for the first insurers. So to say that is a second level of insurance. Yeah. So what we mainly do, we spread individual risk all over the globe to make sure that there are not happening major losses to first insurers and something like that. Yeah. So actually, when we started with Okta, we were looking forward to what I mentioned, having an authentication framework, so in standard to do our cloud authentications in the future. So as we had that years before with our perimeter and Active Directory and all that, we were looking forward to have an adoption plan and a standard to do that in the future. Yeah, so we also wanted to aim for fast integrations, and we from the beginning on wanted to have every user with a multi-factor enrolled, yeah, to secure these access to our systems in future from outside of the perimeter. Yeah. So as we had before, we want to have this single sign-on and mobile access to our solution. So mobile access is gonna grow at Hannover a lot, and so we want to have this easiness to access what we know from private use also in our business. Yeah. So we also want to have secure access for our external. So we are heavily collaborating with them all over the globe, and we want to have them to have an easy access to our systems. And yeah, Okta helped us there a lot. And I can tell you right now, we achieved all of that until right now. And the next thing here is this API access management, which we're going to look out to reach a similar experience even to our customers, like Ilir mentioned forward. Yeah. But in the beginning, we were facing some challenges, like reinsurance is a traditional business, and it was challenging sometimes to bring the idea of a cloud and authentication framework to our company, and to tell everybody, hey, in future we'll get access from outside the perimeter. It would be easy from your mobile and so on. That was not super likely here from everybody. Somebody has concerns and so on, but actually we made good forward steps there. And here are some numbers, some informations about insurance companies and reinsurance especially. So when we were facing, we have people who stay 15 years with our company and our jobs. That is a very great amount, and we love that. But it comes also with a price that they have systems and tools used for over 15 years. And they are not so likely to shift to new ones, and there are some kinds of they present questions. Why are we have to use new tools, and what are they for, and so on, And we are a heavily regulated business, and we have approximately over 40 audits every year, with what IT have to deal with every day. So therefore, again, having these standards and this framework was very easy for us to then go through all of that audits. So, and mainly we are a risk management company. So we are well known what risk are about, and unfortunately, when IT introduces new risk and new tools and new technologies coming with risks, often IT is not bringing bringing any money with that. So there is just the risk and the tools what IT brings, but no premium actually. So actually you will see some risk here, and I promise you have all seen that on your own business, like long ramp-up phases for projects and something. It's like years ago we were starting project on onboardings and so on, and we have software updates that keep us busy every day, and they are coming faster and faster, and it is hard to do that on-prem today, and prioritization, no doubt about that, lack of resources, we all know that, so Okta helped us there very much with their constant forward moves, and with that, so that infrastructure is so easy to manage for us that it really helps us in these operative challenges, And there were security and compliance challenges all the time. When we started with Okta, it was pretty close to the announcement of there's a GDPR coming, maybe in a half year, and that will need you to treat systems different. And actually, people were looking at the systems right now and seeing, they're not GDPR compliant, you can't use it, something like that, And we were pretty sure that they will be when it comes to the point that GDPR is going to be real and going to be established. And again, a lot of vendors, and especially Okta, did their good job to being GDPR ready from the first day. That was a very good thing to us. And there were also some general IT challenges, aging technology. This is something with you have to treat with care, because we have a long story, a long on-prem business, and some technical depths there, which we need to care about. And this technology is coming to an evolution and to a change, and that is challenging for us, and we need some time and to spend efforts to overcome the challenges. And another one here I mentioned is poor technology adoption. People are seeing new tools, and they are not often starting from the very first day to use them. So it takes a time to let them grow and get everybody get comfortable with the tools and work with them. So and sometimes if it's just hard to step into that technology, they will let it down, and they will use the tools they have used for the last years. Yeah? So I can tell you can be busy with all of the challenges all the day. So and we are often in that situation. But in that project, we were looking into that hill which was in front of us, and we were asking ourselves, what is there important? So is there a list we can write down? So what is most important? What's second? What's third? And how would we treat them? And so on. And luckily, we came to a good solution for us, and I'm pretty sure it could be also something for you. There is one thing we figured out that is really, really, really important, and that is focusing on your business partner. Yeah, that helped us a lot to solve these issues and to overcome these challenges, because the challenges are still there. But your business partner, and when we spoke with them a lot of times, we figured out that they have a serious need to go with new tools and to solve their business issues. And with that in mind and with that in focus, there was a solution for everything what we seen were challenging us in the day-to-day business. Yeah? And that was really important for us. But we didn't have been there from the first day, yeah? So it was pretty new for us from IT to speak with the business in that way and being that early in contact with the business and ask them a lot about their needs, because we need to know that to build solutions and to all the challenges. Yeah. Actually, and how did we achieve that? We started with workshops with our business partner together. Yeah, it's a pretty classic way, but it was some kind of new with IT, yeah, to speak with everybody, not only about the tool to implement, but about the issues and the reasons and so on, why our business need to move forward, and what are their challenges they want to overcome, and we want to help with that. Yeah, and we engaged a strong partnership with them, and we did one-on-one sessions. We learned from our business, and we trained them in IT, and so we granted a good partnerships there. We built self-determined teams to work with the business, and sometimes they are invited even from the business parties to come to their meetings and get close with them. Yeah, that was really a game changer for us. Yeah. We foster that close alignment with our business peers in IT and with our business peers in all over the globe right now. And we feel also it is a good idea, and it was helping us to include especially this international point of view, this international thinking into what we from IT doing together with the business. So as we are mainly located in Germany with our headquarters, yeah, we have some kind of a view to our IT landscape and so on, but there are so many different point of views from our international teams that it was very, very valuable, even in that process, to come with them together. Yeah. And there's one last thing I can give you, and I can tell you what is absolutely essential, is when you start that race and when you start that run, and you have to overcome these hurdles all the time, then it will happen that you hit one and that you punch that down. Yeah. But don't stop, yeah, and don't build that hurdles on your own. You're in IT. You should solve solutions. You should help the business, and you should not stop and say, yeah, it's nice. You can build them up, but you should not do that. You should help the business going forward here. Yeah. Thank you.
So we have some time for Q&A, and I thought I would just open up to the audience if there's anyone who is either on the beginning of a journey for a digital transformation, or if you have any particular questions on how these speakers went to addressing this within their organizations, feel free to ask questions. Sure. Okay.
Hey, I'm going to run the mic to you. We're recording, so you got to make sure we get your question.
Do we need it? Okay.
Sascha, you mentioned in your slide 100% MFA, right?
Yeah, right.
How do you handle non-user accounts, service accounts, shared accounts, any of that type of thing? We have encountered certain applications struggle when you're making an API call or you're using an authentication key from an application and it requires an MFA input. How do you guys address that?
Yeah, actually we are in the beginning to doing that story. Luckily we had our perimeter still there and we can keep that non-user accounts inside of our environment, and there are measurements to verify that accounts regularly. But we started with that idea to have even multi-factor for that accounts, and we are in speech with Okta right now to how we're gonna solve that issue in particular for our systems. But it is a challenging thing because it's when it comes to multi-factor for users, the system is a user, and on the other side you have so many different systems, and the abilities to have a more secure access from the systems to others, they are various, yeah, and there is not one single solution for it, yeah.
Hi, can you talk about your use cases for API access management?
Sure. Ilir, I think this would actually be a good one. Well, to give us some context, it might be helpful to learn a little bit more of what you are, what's your role and what you're trying to do. Are you actively looking at that right now?
So we have Okta, we have it for our workforce, and we just deployed it to our customer base, and we're trying to get a good understanding of where we would use the API access management.
Okay, got it.
Sure. I can answer that from a healthcare perspective. So we build our APIs, and we have different levels of users. So we have users who have just created an account. We call them level 2 users. We have users who are approved, patient-proofed. We know for sure there are patients that have been seen. And different levels of users can do different things in our systems. So we use API management to control all our API endpoints, that all our API points will take tokens, and based on what level you are and what permissions you have, you can either call certain API endpoints or you can be stopped right there. And we also have some endpoints that are open for public, so that's one of the ways we use API management to control access level.
Hi, this question is for Sascha. A bit of a classic one. You've been now an Okta customer for 3 years.
Yeah.
Looking back, is there anything you would have done differently to make it even better than it ended up being?
Oh yeah, actually there is something. So even due to the fact we were adopting Okta in the beginning for our mobile devices and for our authentication story, we had some issues when we tried to run both in the same speed, and that was actually not the fact. The identity thing was so fast and we could start with them so super fast, but then it comes to the mobiles, and we had a former solution which we need to get rid of, and that was a different speed. Actually, if you have mobile devices all over the globe and you need to exchange the management of that took you time, and in the beginning we tried to do both in the super high speed, and we felt like, yeah, that is not gonna going when it comes to this hardware to this technology stuff that is aging, yeah. So I would treat it in the beginning more in deep, and I would look at what speed could you run what, yeah. So for example, we have this adoption of multi-factor in the beginning, and we were like, we have the enrollment with your first touch to Okta. Yeah, there is immediately an enrollment, and that is maybe a hurdle for somebody to overcome. But there is something you want to access. Yeah, there's something people want to get access from outside of the business, and say like, yeah, I want to get there. Yeah, and that was a big forward push. But yeah, we should have treated that in different speeds. Yeah.
That 100% MFA has got me intrigued because corporate devices, bring your own devices, the iOS, so we have corporate iPhones, iPads, but you're going to put that, verify on one of those devices. Did you supply your users with devices, or did you enforce their use of their own personal devices?
Yeah, that is a good question, and I'm looking a little bit to my colleague here from the US side because they're yelling at us and say, hey, could you have bring your own devices? And mainly we are in a European environment, and there is not that common use of bring your own devices or use your own devices. So therefore, we only have company mobile devices right now. But when it comes to MFA, we allow the people to use whatever they want. So we have these Okta Verify, we have the SMS authentication, and we have phone call systems. So for people who don't have even a mobile device or even don't have a smartphone, yeah, so they're going to use this phone call, yeah.
I have a question for Ilir. I'm wondering how you're thinking about the patient migration process when you're going from Cerner Identity to the migration from Okta, both how you're thinking about balancing usability and security, so like are you implementing things like MFA, and also about like communicating the concept of that single credential to patients in a way they understand.
Yep, that's a great question because the migration and how we build that flow was something that we kind of went back and forth a couple of times and had different versions of it. The biggest, and like you said, it's a balancing act between providing a secure solution and making the user not jump through too many hurdles, because then they'll get confused and they'll end up even creating more calls to our support. The way we went about it is we wanted to be kind of as hands-off and seamless as we could. So what we did is we put them through a flow where they use their existing credentials to verify themselves with the current IDP. And then once they're logged in, they get passed into our migration flow, where at that point we know exactly who they are. We can take their data, create their new account and let them set up everything. But otherwise, another thing that we were going back and forth was, do you send them an email invitation with a code, and what if that gets lost? And so this way was they use what they already know, what they already have. And the fact that they authenticate against their current IDP, it just makes it that easy for them, makes it secure for us. We trust Cerner to do that part and then pass them over to us in an authenticated state, and that's how it works. And then to your point of how do you tell people and not create confusion about, hey, what's going on? We have email campaigns that once this switch is done, we'll go out to the customers and tell them about what's happening, the identity switch, and the benefits that come with it. And also, if they're not getting that email or they didn't see it and they got into the site, like if they wanted to go and see their portal before they even got their email, it will walk them right through. It's kind of a three-step wizard type of approach that nobody at any point should be stuck wondering, I got here, now what?
All right, I think that's about all the time we have for questions. So thank you to the speakers. Thank you for attending this session. Each of you should have a survey card on or near your seat along with some pens. Please feel free to complete that and let us know your thoughts about the track and the session. Thank you.